right, you guys, in this lesson, we are going to be talking about mixed congenital heart defects. So these mixed congenital heart defects that we're going to talk about are actually pretty complex and can present in a lot of different ways, just depending on how large the openings are or how severe the defect actually is. Now, the reason that they are called mixed defects is because the survival of the patient actually depends on the ability of deoxygenated blood to mix with oxygenated blood. So we have to have blood mixing in the heart. Now, we've talked about mixing blood in a lot of the other cardiac lessons, and for the most part, this is viewed as a negative thing. And that's what stands out with these defects, is that we need that blood to mix, or they're not going to have any oxygen in their blood at all. And the way that the blood is going to mix is that they're going to have, hopefully, an opening. So they have either a PDA, an ASD, or a VSD, and then a foramen ovale. So if any of those are open, it's going to allow the blood to flow. Now, if you remember, the PDA and the foramen ovale are part of the fetal heart circulation. So if you need a refresher on why those are so important, check out the OB lesson on fetal circulation for a refresher on this. But just really quickly, for our purposes, I just want to show you where those two things are. So the PDA is located here between the aorta and the pulmonary artery, and the foramen ovale is right here in this area. So for these defects, we are sort of hoping that those are there and that they're open to allow blood to mix. The first defect that we're going to look at is called transposition of the great arteries, or what it's most commonly referred to is TOGA. Okay, so we call it TOGA. And what's happening with this is that you have the pulmonary artery and the aorta have essentially swapped places. So you have the aorta leaving the right ventricle, and then you have the pulmonary artery leaving the left ventricle. Now, the problem with this is that the aorta that's leaving the right ventricle is carrying deoxygenated blood throughout the body, and it's in its own circle. It's never mixing with oxygenated blood. And then the pulmonary artery is leaving the left ventricle, and it's just recirculating oxygenated blood back to the heart over and over again. And so what you have are these two separate systems. Normally in the heart, we've got that blood moving from the left or the right side to the left side and then pumping, but there's no communication between these two systems that are circulating. So one system has the unoxygenated blood, and then the other has the oxygenated blood, and it's not mixing. So like I said, we need there to be a PDA or an ASD or a VSD that's going to help that blood mix and circulate. So the symptoms that you're going to see with this are going to present within the first hours of birth, and they're going to have cyanosis. But if there is a large PDA or a large opening, presentation may actually be delayed, and then it's going to show up maybe not as cyanosis instantly, but as respiratory and feeding difficulties within that first month or so of life. Heart failure is extremely common with this, and symptoms are just going to get worse and worse until it can be treated. The next defect we're going to talk about is called truncus arteriosus, and this is actually a pretty uncommon defect. But what's happening here is that the heart is actually missing the two distinct vessels that usually leave the heart. So normally we have the pulmonary artery and the aorta leaving the heart. But in this condition, instead, they just have one vessel that's connecting both the right and left ventricle. And you can see in the photo here that we have this one vessel leaving the heart. And symptoms for this are going to be that the patient's going to present very quickly after birth, and it usually looks like cyanosis, tachypnea, poor feeding, and activity intolerance. And again, heart failure is going to develop pretty quickly. And the last defect we're going to talk about within these mixed congenital heart defects is called hypoplastic left heart. And this is actually a pretty complex presentation, and they have just a lot of different structural abnormalities that can occur. But the most prominent and the most significant is the hypoplastic or small left ventricle. And you can see in the photo here that there isn't really a left ventricle. And so that's really going to affect our cardiac output and the blood flow in a massive way. So this left ventricle is small and it's unable to do the work that's needed. Other defects that commonly occur with this are that they have a patent foramen ovale, they have a VSD, a PDA, and potentially coarctation of the aorta. It's very important to know that this particular heart defect is fatal within the first months of life if we don't intervene. The symptoms you're on the lookout for are cyanosis, tachypnea, dyspnea, and that poor feeding and signs of heart failure. It's also important to know that if the PDA closes or if we allow it to close, this patient is going to deteriorate so quickly. And this is because you've just lost that opportunity for blood to mix, which helps increase the amount of oxygen that's circulating through the body. For therapeutic management of our mixed congenital heart defects, the most important thing that we're going to do is keep that PDA open, and we're going to do that by giving prostaglandin via an IV infusion within the first 48 hours of life. Remember, their symptoms are going to get much worse and they are going to deteriorate if that PDA closes. So by keeping it open, they are going to have at least some oxygenated blood circulating. As I said, these are pretty complex, so most of these are going to require multiple surgeries. For TOGA, they need an arterial switch, and a lot of kids who have a hypoplastic left heart actually end up needing a complete heart transplant. Your nursing care for these really complex surgeries is all about decreasing cardiac workload, and this is done primarily by encouraging rest and managing the child's feeding. As we've talked about, when a kid is eating, that's kind of like an exercise stress test. It's really a lot of work. So a lot of our nursing care centers around managing that. We've got a lot more details on that in the congenital heart defects lesson, so check that out for more on nursing care. The complications you want to be lookout after major heart surgery are infection, hemorrhage, stroke, and pneumothorax. Your priority nursing concepts for a PEDS patient with a mixed congenital heart defect are oxygenation, perfusion, and gas exchange. All right, so let's highlight the key points for this lesson. We talked about mixed congenital heart defects, and we've just talked about how they are varied and complex. The ones that we focused on were TOGA, or transposition of the great arteries, truncus arteriosus, and hypoplastic left heart. And the common factor for all of these is that they need blood to mix so that they can have oxygenated blood circulating throughout the body. And that blood is going to mix through either an ASD, a VSD, a PDA, or a foramen ovale. Now, all of these defects are going to present pretty quickly with cyanosis and eventually heart failure. And remember, symptoms will worsen and very rapidly as the heart is overworked. And remember that PDA, we need to keep it open to prevent extremely rapid deterioration. And the way that we do that is by giving a prostaglandin, and we give that IV, and it needs to be given within the first 48 hours to keep it open. And as we said, these are very complex, so most of these are going to need major surgery. And again, these surgeries are not curative. The goal is to optimize blood flow for the patient, but they are going to need monitoring throughout their entire life. But our nursing care is just going to really focus on promoting rest, monitoring feeds, and managing whatever pain they may have from the procedure. And that's a wrap for our lesson on mixed cardiac defects. Make sure you check out all of the resources that we have attached to this lesson. Now, go out and be your very best self today, and as always, happy nursing.